I've realized that stigma kills people.
Yes.
It kills people.
My own observation is that there has been a very tremendous change on the behavioral change amongst the youths. Because previously, before this CYM came in, youths were just doing things that in their own way.
However, the success of the community HIV and AIDS intervention program in rural areas does not come so easy. There are other challenges faced.
As we may know, there is so much that the people in the rural areas where CYM operates want CYM to do for them. So you may already see that we have a long list of their demands on our tables. However, we can't do everything for them, you know. So what we are doing at the moment is that we are only trying to answer to some of the challenges that we feel can have a direct negative impact on the community HIV and AIDS intervention program if they are not handled. I'm talking about the questions of health issues like access to HIV and AIDS treatment, nutrition for those who are living with HIV and AIDS, and also the question of education for the orphans and vulnerable children. Because you know that HIV and AIDS education demands some level of literacy on the part of our beneficiaries. So the question of HIV and AIDS is one of the biggest questions on our agenda as well, which we're trying to tackle, you know, the education for the orphans and vulnerable children. Now, all these issues that I've mentioned, they're all based on the lessons learned from the community HIV and AIDS intervention program. And instead of us feeding them back into the community HIV and AIDS intervention program, what we've done is that we've packaged these issues together into a new program that we call as the community health, education and nutrition, or CHAIN in short. So it's based on the lessons learned from the community HIV and AIDS intervention program.
The activities of the community health, education and nutrition program are all based on the lessons learned and implementation experience of the community HIV and AIDS intervention program in rural areas of Central Province. So, what does the program do? In its initial stages, the Community Health Education and Nutrition Program has concentrated on improving access to HIV and AIDS treatment for people living in marginalized communities, especially the children. With an effective referral network system in Kabwe, the CHAIN program has so far helped a number of rural residents access treatment and live productive lives. At this Information Day in Kasabasa Rural Community in Kabwe District, CYM mobilized villagers for a workshop on access to HIV treatment. Such workshops explain to community members various methods put in place by CYM to access treatment and other related HIV and AIDS services. The nutrition part of the program gives education on nutrition to rural grandmothers looking after orphans and vulnerable children. The activity trains them in good nutrition methods using locally available foods. Indeed, the CHAIN program has developed a number of education initiatives aimed at improving access to treatment by rural people most in need of treatment. HIV and AIDS treatment demands good nutrition. Those taking antiretroviral drugs are urged by health personnel to also pay attention to their nutrition. The CHAIN program is already helping rural residents living with HIV and AIDS on how to improve their nutrition status from the locally available foods. Although nutritious foods are available in rural areas, it is apparent that mothers do not know what foods contain the most value for their children and those living with HIV and AIDS. The CHAIN program is now leading the way in helping rural residents to improve their nutrition status from the locally available food. Other than the Community HIV and AIDS Intervention Program and the Community Health Education and Nutrition Program, there is another CYM program which is paying attention to the plight of children attending community schools. Just what is this program for community schools?
Community Schools Program is a life skills program for community schools. It targets thousands of children that attend community schools in the province. CYM trains teachers and children in life skills and peer education. So basically CYM is introducing life skills lessons in community schools with a strong focus on HIV/AIDS and the matters of sexuality in Central Province.
How is this program conducted?
That was on Tuesday. So after I had to put life skill on the timetable, and then it was the last period.
CYM trains teachers from community schools in life skills facilitation. The life skills are important to the development of the child, especially in this time of HIV and AIDS. Other than the teachers, CYM also trains selected pupils from the same community schools in life skills and peer education. After training, the pupils support their teachers to ensure that life skills lessons are firmly established in their schools. Just what happens during these week-long life skills workshops for children? Before the training ends, pupils from the community schools who attend these trainings are given an opportunity to demonstrate their skills.
Bright to health. Now, now, what to hospital, but not everybody. I better go hospital. At now, come my hospital. Now, what to go hospital? Just so they to live out win.
Who's going to get paid, madam?
My father, some shackle school. School was and be a way. Oh, Dora, she not too much fear you can not pass your friend. Come on, your friend, the power.
This is how it is all done. Both teachers and selected pupils are trained in life skills and HIV and AIDS. But are the community schools implementing the life skills lessons in their schools? CYM undertakes monitoring visits to verify that teachers have indeed implemented what they were taught.